I'm Dr. Stephen Gruber. I would like to tell you about an opportunity to participate in a study known as the Total Cancer Care Protocol. In this video, I will review important information that you need to know to be able to decide whether or not you'd like to participate in this study.
Hi there, I'm Dr. Judy Patel. Let's discuss how you can participate if you want to volunteer for this study. After you have watched this video, if you volunteer to participate, we will ask you for your consent in writing. Before you sign the consent form, please take the time you need to know the answers of all your questions and make sure you understand what will be asked of you if you agree to participate in this study.
The Total Cancer Care Protocol is sponsored by the USC Norris Comprehensive Cancer Center and is a critical part of our mission to contribute to the prevention and treatment of cancer. I'm Dr. Robert Green, and you're being asked to take part in this study because you're receiving care at the Norris Cancer Center. We need your help because we hope to improve the prevention, diagnosis, and treatment of cancer by studying information from as many people as possible. The study will last for many years and will involve thousands of individuals who agree to take part.
First, let me explain the purpose of the Total Cancer Care Protocol. There are hundreds of types of cancer, and even the same cancer can behave very differently from patient to patient. This makes cancer a difficult disease to treat. Our body's cells contain small genetic molecules that determine how cells behave. These cellular molecules make us unique and help determine how your body responds to medical treatments. This is why patients who have the same type of cancer and receive the same treatment do not always have the same results. We believe there's a wealth of information stored in the molecules of our blood and tissue that will help us better understand why cancers behave the way they do. With this knowledge, new treatments could be customized to fit each patient's unique genetic makeup. This approach is known as personalized medicine.
The Total Cancer Care Protocol is a long-term partnership between you, USC Norris Comprehensive Cancer Center, and the physicians and scientists who work with us. Together, we hope to find better ways to care for patients like you. If you agree to take part in the Total Cancer Care Protocol, you will be giving your permission for the following. During your regularly scheduled visits, your doctor may ask you questions about your medical history, family history, diet, health habits, and any treatments you've had in the past. We may review your medical records for other information.
If you have surgery, we may collect any extra tissue that has been removed and is not needed to diagnose your cancer. This extra tissue is normally discarded.
If blood tests are ordered as part of your care, we may collect about 1 extra tablespoon of blood for study. You may be asked to provide a blood sample for the study when you are not normally scheduled for a blood test. This will be limited to no more than 4 times a year. You always have the option to decline the additional blood draw and still remain in the study. Your doctor may order a tissue biopsy as part of your standard treatment. This involves taking a small sample of tissue from your tumor to determine whether or not you have cancer. We may take extra samples for our study.
If you've had a biopsy or a surgical procedure in the past, your tissue may have been collected and stored. We would like to study that tissue. If your doctor orders a bone marrow biopsy and aspiration, which is a procedure that allows your doctor to take samples from the soft center of a bone, we may collect an additional sample for study. A blood sample may be taken at the same time. We may collect additional tissue samples or body fluids, such as saliva, sputum, urine, or feces. We will continue to review your medical records as you receive your routine follow-up care. This is an ongoing study, and we will continue collecting this information for as long as the study remains open, which we hope is for years to come. The research that we do on your donated blood, body fluids, and tissue may be used to discover future treatments for a disease like yours.
We may contact you if new treatments or studies become available that may benefit you. Now that you know what is involved in this study, you may have questions about the possible risks of taking part in the Total Cancer Care Protocol. Since tissue samples are collected only after a surgery that you are already scheduled for, or collected during a surgery that you have had in the past, There are no additional risks associated with this part of the study.
It is not unusual for your doctor to remove extra samples of tissue or cells for diagnosis during a standard biopsy or bone marrow aspiration. The risk of taking extra biopsy samples is low. When blood samples are drawn, you may experience some discomfort or lightheadedness. There is a slight risk of bruising or infection at the site where the blood was taken. The added risk of taking additional blood for purposes of the study is low.
If you sign the informed consent and research authorization form that you will be given after you watch this video, you are permitting Norris Comprehensive Cancer Center to use your personal health information, share your information with other persons or outside organizations, including research institutions, pharmaceutical companies who will work with us. Your name will not be given to any outside organization. The informed consent and research authorization includes a listing of those who will have access to your personal health information. There is a chance that your personal information may be viewed by someone who is not permitted to see it. The risk of this happening is low, since many steps have been taken to prevent this. We understand that information about you and your health is personal, and we are committed to protecting this. Norris Comprehensive Cancer Center will keep your information in a secure environment. We will protect it to the full extent of the law.
You may be wondering, what are the benefits of participating in the Total Cancer Care Protocol? By studying the health information, blood, and tissue of thousands of cancer patients and those at risk, we hope to learn ways to find cancer sooner, treat it more effectively, and even prevent cancer.
While you may not benefit directly from taking part in this study, you could be helping others who may benefit from future cancer treatments. If a promising clinical trial becomes available that may help patients like you, we may contact you to see if you would be interested in taking part in that study.
There are a few more things you should know about the Total Cancer Care Protocol to help you decide if you want to take part in this study. Participating in this study will not cost you any money, nor will you be paid for your participation. Your personal information, blood, body fluids, tissue samples will be considered donation to the Norris Comprehensive Cancer Center and may be used for commercial purposes to help make new cancer drugs or treatments.
Once you sign the informed consent and research authorization, it will stay in effect until you revoke it. It is your choice to take part in the study, and you may withdraw at any time. If you withdraw, you will still have the same healthcare benefits as before and will continue getting care from your doctor. To withdraw from the study, we ask that you notify the doctor in charge of the study in writing. Your study doctor may stop your participation in the study at any time if it is necessary for your health or safety, or if you do not follow instructions, or for administrative reasons. Since the Total Cancer Care Protocol does not involve treatment for your cancer, there is no alternative to offer you other than not participating in the study. Your medical care will not be affected in any way if you choose not to participate. If you believe you have been injured as a result of your participation in the study, or if you have questions about your rights as a person taking part in the study, there is always help available to you. Contact information can be found on the paper copy of the informed consent and research authorization that will be given to you if you decide to take part in the study.
Your participation in the Total Cancer Care Protocol is entirely voluntary. We're asking for you to take part to help us answer many important questions. Take your time to think about the information we've given you. Talk it over with your doctor, family, or the person who presented this information to you.
We hope you will consider taking part in this most important study. Every participant takes us one step closer to making cancer a disease of the past.
On behalf of the Norris Comprehensive Cancer Center and the Total Cancer Care Protocol, we thank you for your time and consideration.